Hello, beautiful people. Welcome to this week's edition of the Montpelier Happy Hour here on WVEW 107.7 LP Brattleboro, your community radio station. I'm your host, Olga Peters, and this is the show where we talk about how everything in Montpelier shakes out for the rest of us. I want to welcome to this week's conversation, of course, regular contributor, Representative Emily Kornheiser from Brattleboro. Hey, Emily.
Hi, Olga. Nice to see you.
Nice to see you too. And welcome, HB Lozito, the Executive Director of Out in the Open. So glad you can join us today.
Thank you. Me as well. Good to see you both.
Before we get started, HB, would you mind telling us a little bit about Out in the Open?
Yeah, absolutely. So Out in the Open, we are a multiracial grassroots movement building organization that works with rural LGBTQ people, building community and power here in Vermont, as well as across northern New England. We started in about 2012 and have been based primarily in Brattleboro. Now we have 8 full-time staff members, both here across Vermont, and also a quarter of our folks are now up in northern and central Maine. So we're starting to do quite a bit more work up that way. And yeah, we explore sort of that fundamental intersection of ruralness and LGBTQ experiences and identity in a lot of different ways, everything from oral history projects to dance parties and everything in between. So we do a lot of different events for and with community. And you can find out more about us at weareoutintheopen.org.
Thank you. Mm-hmm. That was a good elevator pitch, by the way.
Thank you.
Well done.
Probably the main part of my job, so I feel happy to get it down.
Well, we were hoping, HB, to talk to you about a variety of issues today, but we wanted to start with 2 bills that Emily and I have spoken about previously for our listeners, if you go back a few weeks, and that's H89 and S37, and they're both around they're both shield laws, protecting healthcare workers and healthcare access. Just a little update, folks. Both of those bills were signed into or have passed into law, and they're now H89 is Act 14 and S37 is Act 15. Just you might see that written differently now in the news and that type of thing, just to update folks.
Olga, were they? I actually didn't pay as much attention to this as I should have. Were they signed into law or were they passed into law? Do you know?
Wow, that's why I corrected myself as I was talking. So according to the legislative website, so, on May 10th, one of them, and I can't remember which, one of them was signed by the governor. Mm-hmm. And one of them, it just said was approved by the governor.
Okay.
So
it's always an interesting thing because there are a lot of every state does this differently, but little civics lesson in Vermont, the governor has 3 choices: to sign a bill into law, to let a bill pass without signature. So if the governor does not act, it becomes law, and then to veto. In other states, not signing actually causes a veto, and that's sort of where the expression pocket veto sometimes comes from. And so, but in Vermont, this is like very interesting to see like what's signified by what what the governor, and in this case, he sort of permits to become law and what is supported. So I was just sort of curious about that in the grand scheme, but back to the actual subject matter at hand, excuse me.
It's all connected.
Mm-hmm.
So where would you like to start, HB, on talking about this policy and health access?
Yeah, I mean, I think first, starting with, it's really important that we've passed these laws here in Vermont. We're hearing from families, both who have moved here recently, who want to move here, who are looking for places to go from other areas in the United States, who are fearing for their lives, their children's lives, their access to care, who are looking to Vermont and saying, I can see these things that you're doing proactively to support and protect our community. And is this a place for me to come? What does your community look like here? I want to pause and say, we talk about this at Out in the Open all the time, that, we're nationally, we see a lot of those laws being enacted in places in the South and in the Southeast. And, we're in solidarity with our siblings in the South. I think, especially as folks living in New England, it feels really important to not demonize the South. And we know, there's so much about their politic that has been just gerrymandered up the wazoo, and many other things that those folks as well are being oppressed in those areas. So I think, we are no better than people in those places. And that always feels important to me to say in these conversations. So we are along with you, siblings in the South. But we are hearing from a lot of people in many places, looking to come here and not signifying something. This passage of these types of laws within Vermont saying to them, this could be a place for me and my family to go. So lots of appreciation for folks who've been working hard this session and previous sessions to enact those kinds of things. I always love to hold up Representative Taylor Small. We love Taylor. She's not the only person who's been working hard for that, but we love Taylor and are very proud of the work that she's been doing. So always like to start out with some just some context setting and some gratitude for that work. And I think, both of these sit within a context of where we've been headed here in Vermont over the last many years. I think of there's been a many bills that are sort of in the same kind of like pantheon, right? Article 22 feels very related, and that's been a long process. Many gender-related protections in employment and housing that we've had here for a long time. So, to me, I can get wrapped up in, why are we letting the right dictate the conversation that we're having? And if I can step out of that a minute and say also, this is sort of the next, we're in line with work that we've been doing for a long time. So we're excited about what these can do for community now and moving forward.
Thank you. Emily, I know you and I have talked a lot about more of the reproductive protection side of these bills. What, as you were working on them as a lawmaker, looking at care for trans and LGBTQ folks, what were you sitting with?
And like full disclosure, I did not work very closely on either of these laws. Like they're one of the few laws that did not come through my committee. And so I've been in full support and, have helped with sort of conversations around messaging and supporting the caucus. But I was not instrumental in getting either of these laws passed, though I'm so happy that they did. I think, as HB said, they are part of this spectrum that is sort of legal protections for people to receive care, legal protections for folks providing care. And then the other side of it, that's like sort of the next step that we have been working on and will continue to work on, is access to care, right? And that's sort of like the whole range. And that just comes into like, this stuff is really basic. And sometimes we spend really an exorbitant amount of time just like catching up many of our pieces of statute with just like really basic common sense, like as we revise each statute, we like degender the language in it. Like that's something that's like still an ongoing practice in our that we need to do in our legal work. As the work on birth certificates, the work on licenses that we did a few years ago. It's just like letting like people's lives function without the state interfering in it, really, is what a lot of it feels like.
Thank you.
Like letting doctors do their work, letting nurses do their work, letting other healthcare practitioners do their work. And I appreciate it in a place like Vermont, where we can sort of congratulate ourselves on how wonderful we are and how open we are, but know that like every day there are parents objecting to things happening in schools, and there are schools objecting to things happening in homes, and there are people who have terrible encounters with the medical system. And so I think the more we can do to not have government be an added obstacle in navigating a life that can often be very challenging is really like best practice. The other place I see this is we actually did an enormous amount of suicide prevention work this year.
Oh yeah, we haven't talked much about that.
We haven't talked much about that. But the sort of headlines around the suicide prevention work was around guns. And then we did a lot more around sort of access to mental health care. But, the recent youth risk behavior survey came out, and, we see sort of across the board that queer youth have significantly higher rates of mental health struggles and suicidality. And so that also, I think, is a way that we, this work is a way that we prevent suicide. I don't like to dwell on that because I don't like medicalizing what are essentially like people's problematic encounters with society and with patriarchy and with capitalism. But it's real, and that is a part of the work, and I think it's important.
Can I follow up on two things Emily mentioned?
Mm-hmm.
Yeah. One was the birth certificate work recently. And I think, again, that was a great, well, first I'll say, yes, legislation can't fix everything. Long way to go, as always. And I think, the birth certificate legislation that passed last session, we've been working with local families and lawyers over the past year who that legislation was so narrowly focused on amendments and updating existing birth certificates of people who have already been born. And so if a local family came to us and they said, we're about to have a baby, and we'd love to have their birth certificate be, all genders, genderless, from the time that they're born, we don't want to have an amendment, and we're really having some problems with the Vital Records Office. They're saying, just put something down and then change it. And that's what we can do with this law. We can only amend. And yes, which has been very interesting. So a wonderful local lawyer, Meg York, who has previously been at the law school and is now with Family Equality Council, had been working with that family and won their ruling to say that, yes, we should be able to issue an original birth certificate. And we were hopeful that that would sort of pave the way, set the precedent, but the Vital Records Office is continuing to be somewhat obstructionist and saying, we got to stick to what this says. And so I think, we talk all the time Out in the Open about how we're constantly iterating our work. We're trying something out and then we're learning and we're getting feedback and doing it again. And I think that to me is a great example of that, of like very beautiful, wonderful intentions. Everyone was like, yes, this is a thing we should do. It has improved many, many people's lives. And still there's this little piece that we need to come back and correct. And so, yeah, you had mentioned that birth certificate law. So that like nuance was coming to my mind of, and wonderful that family also, saw that need for their own family. And we're like, yes, we are willing to go through this court process in order to do that.
I would love that's has become one of my favorite things about the legislative process. Mm-hmm. So I used to see it as this incredibly frustrating thing that it takes like 5 years for between someone even having an idea and that idea getting in a hearing. And now I see that like the entire statute is just a work in progress. Mm-hmm. And we are all like, obviously we're all just flawed humans working through it, but like the entire state is a collection of flawed humans working through it. And so like, as things come up, the statute is able to like constantly iterate and improve in most cases towards whatever like people's lives are and what people's lives need. Like that's a best case scenario. But in a situation like this, I could see it like next year, once that's sort of brought to bear, like it's not even it doesn't need its whole own bill anymore. Mm-hmm. That's something that could just happen in like a technical corrections bill because we've already had the difficult philosophical argument about it. Now it's just like, oh, wait, we need to tweak that thing to make it actually work properly. There we go. And I just love that part. Mm-hmm.
Yeah, I think to me, it's why relationships like this are so important because I'm like, hey, here's how this is working in community or not, as the case may be. Mm-hmm. And like, how can we fix that? And you're like, great, I have the know-how, like just put it in this place. And, I'm like, I didn't know, about a technical corrections bill. So I think like, at our best, those are things that we can do in sort of like the back and forth of both of our expertise and roles. So anyway, happy to be having the conversation.
Can I inject this is my own little belief system here. Instead of collection of flawed humans, I think we're a collection of evolving humans because as society changes, we need to just like we will see things we didn't realize before. We will learn experiences we didn't have. And so I just like to think of us as evolving humans.
Mm-hmm. Okay.
Yeah, you both are like, oh, we are so flawed. Are you kidding?
That is fine.
Mm-hmm. I'm like, that does take us at the second place I wanted to follow up on.
Great.
Which, Emily, you were. I'm like, can I make this segue? I think so. We built kind of a whole program around that idea of like know better, do better, right? So for many years, we had been offering trainings to healthcare providers about working, in the most supportive, best and effective ways with LGBTQ people, and not really seeing much change in the experiences of our community members who were seeking care. And so a couple of years ago, we're like, okay, let's change our strategy here. We've always focused and centered on our community members. What would it look like to design a program around increasing access to healthcare that has individual community members at the center? And so right now we're in our second year of our HEART program, which stands for Health, Equity, and Access for Rural LGBTQ People. It's currently being funded by the Department of Health. And it's a peer support program where we recruit and train volunteers to attend medical appointments with community members, we offer transportation, to have people just alongside you in your care planning, to have people alongside you and sometimes in your debrief, but really to be in the room in a consent-based way with people so that when you're having that interaction, if your provider says something that is terrible, you're not having to address it yourself because that can feel really hard and scary, or just you're in so much pain that you're not seeing what's happening. So you've had those conversations before with someone. And I think to your point, Emily, about access to care, we can open the door, but if people are having so many bad experiences and so much trauma related to care that they're not able to walk through it, metaphorically, that this is one way that we're trying to address that issue as well. We're talking before we pressed record, Olga, about the legislation can take us so far, but we need programs like this to take us the rest of the way as well. So that's one other thing that was coming to my mind in what you were saying, Emily.
That is very cool. I didn't know about that program.
Mm-hmm. Mm-hmm. Yeah, so we piloted it here in Windham County in 2020. Well, we're in 2023 right now. In 2022, oh my God. And then we've recently, we're working on expanding it both in the Northeast Kingdom as well as continuing here in Windham County. So,
and just for clarity, when you say the Department of Health, Vermont, or the Vermont Department of Health, the Federal Department of Health?
Yes, good question. Vermont Department of Health.
Okay.
And so it's presently, like so many things right now, it's actually COVID money that has flowed from the federal department down to state departments. So it's was part of a $5 million grant funding health equity related programs all over the state. And so it's coming from that.
This program, I love it. I'm even just thinking of myself having had interactions with healthcare workers that were not positive, yeah. And how much I kind of wish someone had been there. What is some of the feedback that you're hearing through this program? Are there themes coming up? I'd love to hear more about that if you can share it.
Yeah, a lot of it is, people, it's such a big system, and a lot of it is people want and need support with just navigating many different parts of it. And as well as things that are in place to support people already, but aren't quite getting there. So one person that we worked with last year lives here in Windham County. I'm like, there's 7 places to start this story. One of them is that there are very few providers, more now than there were 10 and 15 years ago, offering gender affirming care within Vermont. We send a lot of our folks here in Windham County up to Dartmouth to receive care, which, borders are fake, but they are in New Hampshire. And people often, for specific kinds of care, having to drive multiple hours one way to receive it. That's improved a lot, but is still true for many people. And so this community member lives in Windham County and was having a surgery consultation, thought they had a Medicaid ride lined up from here to Chittenden County. It was the day before their appointment, and they learned that someone along the chain had not sent the paperwork to Medicaid. They'd been waiting months for this appointment. It was still, during the height of the pandemic, and they were going to have to miss their appointment and reschedule who knows how many months later. And so they called us, we were able to provide transportation because we had funding to support transportation as part of this program, and give them, not only a ride to and from multiple hours, which transportation we hear all the time in many different venues is a huge challenge for people within our state, but also a ride with someone who understood, what it was that they were going through and was able to provide emotional support for them to talk through what they were experiencing in the lead up to this procedure. And so that was really wonderful. So some of the themes that we're hearing a lot from people over and over is transportation, even when they have, Medicaid rides are a wonderful support for people, but there's barriers to accessing that as well. They don't always come through. So a lot of those kinds of things, themes around people having to travel really far for services. Another story that comes to my mind is there's again, it's actually very similar. There's a comprehensive care clinic here at Brattleboro Memorial Hospital for folks who are living with HIV and AIDS, and it's federally funded. It provides free care for, as I understand, any patient who is receiving care there. But again, people receive huge bills every time after they were there. So people are getting these bills for many thousands of dollars in the mail. It freaks you out, very nerve-wracking. Does that make you want to go and receive care? No, it doesn't. But everybody sort of knows that it's paid for, but there had been a lag in the system, so that, people were receiving the bills, but the reimbursement wasn't coming through. And so folks have been individually trying to solve this for quite a long time, without much movement. And so folks from our HEART program were able to work with the clinics to just, explain, use the power of an institutional name, and have an organization behind it, and resolve those kinds of issues. So a lot of things that are, people getting caught up in a system and needing support, or just being able to vent and talk with someone. So lots of those kinds of themes, and lots of just people, who have either had very negative experiences accessing healthcare presently or in the past. And, that trauma is really sticking with them and making them have a difficult time accessing care. So a lot of what we've been doing is, offering that listening ear, emotional support, help making an appointment, all that kind of stuff.
It's funny, every single time, like the first 5 times I got a mammogram, and I had to start getting them quite young because of family history, I would get this huge bill in the mail. And I know, because I'm a legislator, I know that I'm not supposed to pay for a mammogram. And it would always take like more than an hour on the phone with Dartmouth and BMH to get the bill erased. And finally, like before I went in for like one of them, I was like, you know what? I think I need to stop solving this on my own and just like solve this systemically. And I spent like a couple hours being like, okay, you guys need to figure out your paperwork systems. Like this should not be my problem every year. And it's extraordinary. Which brings me to sort of like healthcare coverage. And you talked about Medicaid rides. And so I have talked with the chair of the healthcare committee a little bit about like how sort of the next wave of legislation, which is harder because it costs money. Legislation that costs money is always much harder. What aspects of gender affirming care can and can't be covered by, or is required to be covered by Medicaid or private health insurance providers? I know that's a very sort of interesting and controversial thing in terms of abortion access, right? And in Vermont, we actually do cover abortions with Medicaid dollars, but you actually have to know that in order to get it covered. So how is that all working?
Yeah, so I worked pretty closely with Vermont Medicaid in 2019. Folks at Vermont Legal Aid were also like really deeply involved in that while they were updating their rules for coverage around gender affirming care. And we went, back and forth for many, many months. Eventually, I actually don't know how often that process happens. It should probably happen more often than it does. And the improvements were good. And also there was a lot that was left out. And I think to me, right, it's like, there's kind of 2 main themes that I see in things that are covered and not. The line seems to be drawn at things that the government considers cosmetic, which, we in trans community know are not cosmetic. And for the vast majority of those procedures, they cover trans women and femmes. Like they just tend to be the things that people say no to. So that's for things like electrolysis, vocal cord shaving, facial feminization surgery, all of those kinds of things that folks consider cosmetic have not been covered. And, we gave this feedback to them, these are critical parts of people's care. They need to be covered, like the rest of these things that are in here. And those things did not make it in. Facial feminization surgery might have made it in. I'd have to go back and look specifically, but I'm almost positive electrolysis was a no. And so there's a whole, long list of things that are sort of in that category that we know are very critically important to people. There's what just flashed across my mind also was when we were having hearings about that, they were happening at the state office building in Waterbury where you have to show your ID to get in. And we were like, this is not an acceptable place actually to have hearings if you want to hear from trans community. It's just having to show a government issued ID when you're walking into a hearing to talk about your own trans healthcare is so we did some work shifting the location of that. And the other big piece to me is there's always a lot in trans healthcare about consent and about body autonomy and trusting people to know what is our own care that we need. I wrote a piece for our newsletter sometime last year. It's a great story on National Public Radio that was talking about the court case that was before Roe v. Wade. And the reporter was like, can you imagine a world in which you have to have letters signed by 2 psychiatrists to get an abortion? And I was like, oh, I can, because that's literally what you need to access most of trans healthcare in this present moment. And, they seem to indicate this is totally absurd. Why would we ever do this? And we talked about solidarity a little bit, right? What a powerful moment for solidarity among cis women's movements and trans movements to say yes, this is presently what people are experiencing. And most of that continued to be cemented within the Medicaid changes. You still have to have consenting letters from not just a therapist, but from a therapist that has a specific terminal degree in order to access care. There's many of those kinds of checks. You can't just go in and say, I know that I need this procedure and I'm working with my primary care physician. So there's, cosmetic considerations, which we know are not, and consent-based considerations, which I think there's, a pretty big need for improvement on both of those within what Medicaid will cover.
Mm-hmm. Thank you, HB. We're just out of time in this first half, but is there anything quickly we want to leave listeners with before we
I think another line that we can explore another time, sort of in the sand around coverage, which I think is also another solidarity issue, is reproductive care. And so, right, that's freezing sperm before taking hormones. That is all that is needed to, for pregnancy to happen. It's all of those pieces, I think, are also sort of on the other side and a really incredible opportunity for some solidarity.
Mm-hmm. I'd love to talk about that.
Thank you. Hang tight, everybody. The Montpelier Happy Hour on WVEW 107.7 LP Brattleboro will return right after we hear from some underwriters. Welcome back to the second half of the Montpelier Happy Hour here on WVEW 107.7 LP Brattleboro, your community radio station. I'm your host, Olga Peters, and if you're just joining us, I'm talking with Representative Emily Kornheiser, as well as HB Lozito, who is the Executive Director of Out in the Open, which is based in Brattleboro. If you are looking for the happy hour, I want to remind you, you can find us Fridays at 2 p.m. on WVEW. We have a rebroadcast on 8 a.m. on Wednesday mornings, if you want to catch us then, as well as thanks to BCTV, you can see us on many PEG stations around the state and wherever you subscribe to your podcasts. Emily.
Olga.
Remind listeners of.
I would. The views and opinions expressed here on the Montpelier Happy Hour are those of the host and the guests, respectively, not the station, not their employers, not their friends.
Why, thank you. So HB, before the break, you and Emily were talking about healthcare and healthcare access for folks in the trans community. And I want to pick up a thread from before the break. You were talking about reproductive care and reproductive access. I would love if we could continue with that conversation.
And I think I was thinking about this not just in the context of trans healthcare, but like healthcare for all the queers and really all the people.
Yeah, absolutely. I mean, one thing that sticks out to me, Emily, you were mentioning earlier in this conversation, right? Like updating language and degendering legislation. And I can remember having a conversation with Representative Sarah Coffey, and maybe with you too, at one point that I was like, we love the language that's in the Article 22, is it Prop 5 legislation? And like, just want to be, is that like done changing? Is it completely cemented? I remember you being like, yes, like the language is sticking. And I think something that's been really wonderful about the language in that legislation is it is so broad, right? And I think it was really important for us that language should be, pregnant person who's pregnant, gestational parent, all of those kinds of things. And I think that's opened up to me a lot of opportunity within that. So I felt like, we landed in a very good place with the breadth of the language that was in that bill. So wanted to mention that. And I think, yes.
And can I like make a finer point on what I think you're hinting towards, which is that essentially like we have a constitutional amendment that has a constitution now. It's not, we have a constitution that includes a right to reproductive liberty for all people, basically. And so what does that mean? And I think it was narrowly interpreted by a lot of people as a right to not parent, but it can also be interpreted as a right to parent.
Yep.
And if it's a right to parent, what is the state's obligation with regards to making that right available?
Yes, absolutely. I mean, I think, yes, reproductive liberty is like a wide open phrase. Yes, absolutely. To me, it's like we talk with families all the time about reproductive material storage. That's not something that's covered by insurance and is extremely expensive.
What is reproductive
material storage? Yes, I was like, reproductive
that's
material storage.
Very charming, but like, what is that?
One of my best friends is a midwife, and she's always using phrases like that. And I'm always like, what if I learned from her? Yes, I was about to be like, that is not an accessible phrase in any way. So yes, that means sperm, eggs that are coming from people's bodies, either, because that's something that you want to do in your life, regardless of whatever care you're about to receive. And I think that's like 7 thoughts at once. That to me is one point, which is this is accessible for anyone, whether you're a member of the LGBTQ community or you're not, right? Like, everyone has gender affirming care. This is care that's for everybody. And so that could mean, someone wants to freeze their eggs for any reason. It might be because they're about to access hormone therapy and they want to make sure they could make that decision later down the road for their family. Similarly with sperm storage. But for any reason, that could be for a cisgender person as well as for a trans person. So that's reproductive material storage. You're taking reproductive material, sperm and eggs out of your body, you're storing them for later use, so that you can be in control of how you want your family to look and be, either now or in the future. And it tends to be something that is quite expensive, is not covered by insurance, and is also a really important way that many, many kinds of people are building their families, or not. You might make that decision now and then never choose to access that, and that's okay too.
Yeah, I mean, I have like an incredibly cis sorority girl, grew up in the South, cousin, white, quite wealthy, lives in New York, who froze her eggs because she just realized that there wasn't a baby coming anytime soon. Yeah.
Absolutely. And we should all be supported to be able to do that.
Yeah, even if we, don't have necessarily the financial resources to do that. Right?
Absolutely. Yeah. Absolutely. Yeah. That I feel like that's one part. I mean, I feel it to me. I'm like, reproductive liberty also includes people who are currently incarcerated having access to their children and being able to maintain a strong relationship, right? Like that's reproductive liberty. All of these kinds of things. I think we had a conversation a long time ago about, how does that affect how DCF is interacting with people, and are you being able to be supported to maintain those relationships with your children? To me, reproductive liberty is an extremely broad phrase, and thank you for being like, say this more specifically, that I think has a lot of implications for trans and LGBTQ people, as well as for everybody in the state who either wants to or doesn't want to have children in their life in some kind of way.
And I'm going to pause for a public service announcement that's only peripherally connected to our conversation. But what you said about sort of a right to parent and the Department of Children and Families, I just want to let listeners know that the Office of Child and Family Advocate, which we talked about an original bill on the wall, it was one of our first episodes, I think, 5 years
very
ago,
early on.
Is now real. It has been started. They have hired their first staff person. They're about to hire their second staff person. The staff person, Matthew, came down to Brattleboro for like a big celebration, a kickoff party at the Root. It was really an incredibly inspiring evening. And I just so the things we talk about on this show become real and actually make a difference in people's lives. Who knew?
Yeah. It's amazing.
It was kind of our hope, wasn't it?
Yeah. And so if you're a person listening and you're interested in engaging with that office, you can just look up the Vermont Office of Child and Family Advocate, and they have a website and a phone number and stuff now.
I also, wanted to shout out, I know Sheila Linton at the Root Social Justice Center here in Brattleboro has been doing a lot of work around that too. So thanks, Sheila, for that.
Thank you. Yeah, very excited to see that finally become. And it reminds us sometimes the best take time. HB, there's been a lot of conversations in the ethos, out in the ether, I should say, around, I guess you could call it trans culture wars. And I know that you were listening to such a conversation the other day and had an epiphany.
I did.
And I was wondering if we could hear about that epiphany.
Well, and can I set some context for, I think maybe why it was a conversation on public radio is, there have been drag story hours been happening at libraries and schools around the state for quite a while. And we have this funny tradition in the Vermont State House where we have a devotional every morning to start our day. For many years, that was just ministers. And then I think they might have thrown in a few Jews or Buddhists after many years. And then poetry finally got introduced in music. Things have been improving ever since. And then in the final week of the session, we were really so blessed to have our very own drag queen story hour as a devotional. And it was really just a totally delightful way to start the day with a children's story told with much drama and glitter.
Everything's better with glitter.
And there was some fairly horrific fallout from that. And some people being really shitty. Ooh, I'm not supposed to curse on the radio. Excuse me. I think that was my first time. I'm kind of excited.
I think I'm impressed.
Yeah.
So just for context, HB, because on WVEW, well, you know this because you have a show. You're not allowed to, the FCC. I'll bleep it.
Okay.
I don't know how I'll bleep it, but I'll bleep it.
I'm excited. Okay. So anyway, that's sort of the context for, I think, maybe why there was recently an NPR show about it, but onwards, HB.
Yeah, I think that's good context for us locally and also, of course, nationally. This conversation is happening all the time. And I was listening to the radio earlier this week and folks were having this conversation and someone was just going on and on and on about Emoji Nightmare, Justin Marsh. Hello, Justin. We love you. Who gave the devotional that Emily was just talking about. And really, it's this whole conversation, I'm sort of I don't even want to validate it in any way by talking about it. And also here we are, it's impossible to ignore. And I also am hopeful that we on the left continue getting better at setting the agenda and talking about the things that we want to talk about, as opposed to letting the right drive the entire narrative in the conversation. I will put that aside. And this caller was basically like, this queen is so terrible and does these really vulgar shows and they're not for children and blah, 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 blah. And I don't know whether, it's my belief that whomever is like the genesis of this conversation nationally completely understands what they're doing and knows they're obfuscating and drawing connections that are not real. And I think callers like this, who are just people in the world, who are not the genesis of this conversation, can't necessarily parse that there are differences. And I was like, really just thinking about this and, getting agitated. And I was talking with my partner and I was like, why can't they see that these things are different? I was like, I need an example. Who's my example? I was like, oh, Bob Saget, right? I was like, Bob Saget and George Carlin. This was my epiphany. And I was like, I feel like this example makes it so clear to me what the conversation is, right? They're putting things together. Okay, these performers can't possibly discern between what's appropriate for an adult audience and what's appropriate for a children's audience. And folks who are having this conversation are making it seem as though drag queens are the only people in the universe who do that. Obviously, they must be putting on shows that are meant for adults in these children's contexts. And we know that they're not, right? And I was like, okay, Bob Saget, star of Full House. I grew up watching him on a show that was made for children, was astonished when I was an adult to find out that he is like the dirtiest comedian.
Really?
Ever been. Yes. His stand-up is like so vulgar and just being like, this is mind-blowing. And similarly to George Carlin, I think I was like, George Carlin has that piece talking about cursing on the radio, right? Like has that piece that is like, here are 7 words to never say. Again, like extremely vulgar, made for adults. I grew up watching George Carlin as a young person on Shining Time Station, Thomas the Tank Engine, right? Like these two people that are very famous, extremely well-known in our culture that have, right? They have the ability to discern, as many performers and adults do. And I feel like that was my epiphany. That I was like, I keep looking for in this conversation how to make it clear to people that it's absurd. It's a ridiculous conversation to have. They are purposefully trying to demonize people in our community that are parts of a culture which they don't understand or don't choose to understand. But I feel like having examples like this that are outside of LGBTQ culture just made it clear to me, this is exactly what they're trying to do. Can we hold these examples up that are from straight and cis culture and be like, see, here is a performer that has these two opposite ends of the spectrum. And like, yes, people can discern what is appropriate material within these different contexts. And that really helped me both made clear the absurdity of this conversation and felt like it could be helpful examples for me when I'm in these conversations with people to be like, these people, here they are, think about these different areas where they're using that material. So people may be like, that was not a grand epiphany. It felt very important for me this week to think about who are those. Emily's like, not good. Anyway, go watch Full House. And
I know it works. And I'm like excited to learn about Full House guy.
Yes.
And like, I think also we all do that. So, like I give a very different presentation when I talk about democracy in an elementary school.
Absolutely.
Than say I do on this radio show where I am apparently mostly capable of not cursing. So in my daily life, I curse. I don't even know if sailors actually curse, but I curse a lot, but I actually don't do that in the State House.
Mm-hmm. Yeah.
Mm-hmm.
Yeah. We're like all deeply capable code switching folks who can change ourselves for various environments and various appropriate audiences. Yes.
Mm-hmm.
Yeah. I would actually argue for anyone out there who doesn't work in the arts or doesn't know performers, the first rule is know your audience. Like that's rule number 1. After this, well, actually probably rule number 2, the show must go on is rule number 1.
And of course, we know that arguing those finer points of what it is that they're saying is not the point. And I think to me, that helped me vent some of my frustration in that conversation and give it a direction to validate to myself, like, yes, this conversation is completely absurd. they are purposefully trying to fan the flames to make things worse for us. It's them.
And to criminalize anything that is
Absolutely.
even slightly different from this very core white Christian nuclear norm.
Yeah, absolutely. And I think, it would be so laughable if it wasn't becoming real for people. And I think that's, to me, like it is completely absurd and is having very real effects on people. And I think, for us as an organization that believes in abolition, right? Like, we don't want to see more laws criminalizing basically anything. And I think like that fear is real for many members of our community, across the United States right now. And I think the other place that I continue to fall back on, right, is like, I'm not saying it's good to go back to these places. It isn't, but I do believe in the ingenuity and the strength and power of LGBTQ community. And like, we've been up against laws like this for many, many, many years, in people's living memory right now, where are many laws where you had to have, 3 pieces of like gender appropriate clothing if you were at a bar, and they'd come in, okay, are you wearing a necklace and a skirt and high heels? Great. Like, you're good. We're not going to haul you off right now. And I think, you were saying, Emily, like, yes, here we are coming up on Pride Month, where, certainly our movement did not begin at Stonewall, but that is a flashpoint that many people are aware of in 1969. And I think it's a really important moment to look to and learn from and remember the lessons that our elders have taught us and that they've experienced. And, hey, how did you all deal with this when you were up against it in the 50s and 60s, and what did you do and what were your strategies? And I think it's social movement history is a big part of what we do at Out in the Open for some of these kinds of reasons. And like, not just the
50s and 60s, HP.
Absolutely.
I mean, like, kids today could learn from the 80s a little bit.
Absolutely. Okay. Yes. The ACT UP Oral History Project is very good and super important. And yeah, I just think, it is a bad place. I also think who is served best, which to me, I feel like the right is best served when we also, just bring this like really heavy language of like, this is terrifying. Everyone should be scared. And like, okay, let's look back at how have we come to this place, both how have we come through this place in the past, as well as how have we come back to this place. But, we will make it through. And I do think, the right is best served by that kind of language and really making people scared.
I really appreciate that point so much, because I think going back to actually where we started the show today, I think one of the most powerful things about having these shield laws is, they might actually not ever be needed or actually ever work in a legal context. But what I think they do is provide enough shield so that folks living in Vermont don't have to be scared, which enables them to act in such greater solidarity with folks who might be much more scared in other places, so that we can actually like move out of the fear place into like a place in our bodies and our lives where we can actually make good in the world for people. And I think that's an incredibly powerful part of movement building and of community and what is needed right now.
Yeah, I remember actually quite a few years ago at the Translating Identities conference, there was like, they had a transmasculine breakout and we were having this conversation. People were like, I just want to access care so that I feel more comfortable and I'm better. And like, all this stuff, I'm feeling really good in myself. And I remember someone saying, great. So what do we do with that space that we've created for ourselves, right? Like, we bring other people with us. We use our comfort and space that we've created to act in solidarity with others. I think about that a lot as a white person, right? Like, how can I use my own comfort to give myself energy to support movements? And yeah, I think exactly what you were saying. And I think certainly there is a lot of struggle within Vermont. Certainly there's a lot of people within LGBT community who are having many different kinds of experiences. And I think what I'm hearing you say is it can possibly give us some kind of psychic space and support that we're not having like the same kinds of like psychic and real pressures weighing down on us in the same way.
Yeah. So you talked about abolition. How close are we to the end of the show, Olga? I'm feeling like
I was just doing the math. So we have
Emily's like, let's open abolition in the last minute. Great. I should just come back.
Yeah, well, of course, HB, you're always welcome back. We have probably about 8 minutes. So can we shove abolition into 8 minutes?
I like you can shove all of abolition. I'm just going to use abolition as a segue.
Okay.
But something that we have worked together on in bits and pieces is decriminalizing sex work in Vermont and what that looks like. And I think often, sex work and sort of the abolitionist mindset around decriminalizing sex work, I think is often very, very confusing for a certain thread of white feminism or just feminism. And so I think it's often confusing to folks that I talk to, the idea that like it's actually a pretty decent part of what a lot of queer liberation work is. And so I'm curious to hear more of your thoughts on sort of where you see those alliances.
Yeah, absolutely. I mean, yeah. So I'll start, I guess, with right here we are coming up on Pride Month. And I think like our LGBTQ community is vast and broad, and we need to stick together, right? And that includes folks who are sex workers, that includes folks who are in leather community, that includes folks who are parents with children or caregivers, right? Like it's all of us together. And, we've talked about solidarity a couple of times already in this conversation. I was thinking earlier about like there's such, for me, as someone who grew up in the 90s and was doing early queer activism for myself in the early 2000s, like such an important moment when the Human Rights Commission, decided basically to leave trans people behind. They were working on federal equality legislation, and they really specifically were like, yes, you're right. We cisgender LGBT people should move forward and like leave trans folks behind. And I feel like many people don't know that happened. It feels like a really important moment to me for all of this kind of stuff of saying like, yes, this major national mainstream LGBTQ organization saying we can splinter our movement into many things. And the rest of us being like, no, we definitely can't. It's all of us or none. Right. And so I think
and they were basically saying like had a theory that like, queer marriage was possible if it wasn't queer, if it was just white and gay, right?
Absolutely. Yep. Yes. Yes, they did. And it's like, I feel a real sense of loss for our community that type of progress has allowed these kinds of conversations to continue, right? It's like, we were just talking about queer movement history in the 60s and 50s and 60s. And I think, at that time, certainly there were rifts as far as I understand, and people were different from each other within the community, but like there was, as far as I understand, much more cohesiveness, right? Like everyone was cast out from mainstream society, so we all had to be together. And now some of us in the community are more palatable to white mainstream society than others of us. And I think it's done a real disservice to our movement to allow people to, hack off a piece of us here and a piece of us there. And
and that's the history of white supremacy too, right?
Absolutely.
In America, right? Like different ethnicities got to be white as that was needed to
absolutely
the system. This is like, these are amazing closing words we're having here.
I'm like, well, it's the same. Yes, it's the same, right? Like working class and poor people's movements, right? As well. And using race to divide us and capitalism and keeping us apart from each other and all of those kinds of things. And so it feels really important to me. Yeah. In this conversation about sex work, like right there, we're together in this work. And I think some of what I appreciated about the legislation that was working its way through in 2019, also like timing, I feel like beginning of 2020, right? Like right before COVID came about, like that was up in that session. And I think those pieces of legislation did a really important job of drawing a distinction between sex work and sex trafficking. And I think that's something that a lot of people don't understand. We've mentioned body autonomy, we've mentioned consent a number of times in this conversation. And I think that legislation was helping us parse a conversation in Vermont to help people understand what are the differences between sex work, which is largely consent-based, and trafficking, which is largely not. And I think that's been up in Brattleboro recently, as well as we've seen arrests and that kind of thing happen here too. So I think, the decriminalization of sex work feels really important. in general.
And I can't help but say this, also a really important way to actually prevent trafficking.
Yes.
Trafficking. Because the more those two things can be differentiated in the law, the safer everyone is. Both those engaging in sex work and those who are being trafficked.
Yeah, absolutely. And I mean, we've done some work on that. There's a lot of sex workers in our community who we love very much, and also want to hold up the work of the Ishtar Collective, who are up in Northern Vermont doing really fabulous work as well. So people should look them up too.
Thank you. We are down to like a minute. What do we want to leave listeners with before we head out?
I just want to make sure that folks know that they can get in touch with me by going to emilykornheiser.org. And I want to make sure folks know how to engage with Out in the Open, because you have this really incredible mix, HB, at Out in the Open of community-based services and sort of a national or regional lens that I think people might lose track of sometimes, given that's sort of not the usual way of doing business.
Yeah, I think I described us at the beginning of this as a movement building organization. We're not a social services organization, and we offer lots of different kinds of support for community that are sort of in that realm, mostly peer support. So yeah, folks can get in touch with us at weareoutintheopen.org. You're welcome to email me, hb@weareoutintheopen.org. We've got some community events coming up on June 11th from noon to 3. We're having our annual Pride Family Potluck. So it's for people of all ages. You don't even have to have a queer person with you. If you have a queer person in your family, come and be around other people. And we're also doing some fundraising this month as well to support our work throughout June. We learned that people really like to give us money when it's our month. So you are very welcome to do that as well. And we have a lot of community events that are fun. And also, we're an organization that's been at the front of talking about rural LGBTQ issues for a long time. And so there are a lot of people that we're connected to nationally. If you're in other parts of the United States or just curious about what else is happening in other places, get in touch.
Thank you. Thank you, everyone, for tuning in this week to the Montpelier Happy Hour on WVEW 107.7 LP Brattleboro, your community radio station. I want to give a very specific thank you for today's conversation, because when Emily and I started this show, today's conversation just really reminded me we wanted to talk about stories. We wanted to give a space for policy and human experience to kind of meet. And I've always seen Emily brings the experience of being in the legislature. The guests always bring their experience from whatever conversation and topic we're covering that day. And I've always felt my job was to hold space and to just keep the space open. And today's conversation just reminded me why I like doing this. So thank you, Emily, and thank you, HB, and thank you to everyone who tunes in to the Happy Hour. We will be back next week. Take care, everyone.